Yeah, hi everyone, welcome to my channel. My name is Dr. WAN and I'm here today to go further with regards to diabetes. I know many of you here have watched my channel and there are a lot of questions coming up, so I choose to make this video now to go further. The next step to explain certain things that in the other video I tend to neglect them, which are very important. So there are three things here which I'm going to discuss in three different videos for you to understand. The first one is gastroparesis, otherwise known as slow stomach emptying. Then number two is cookery and cooking. And number three is food types. So these three things I will explain further in detail. What is it and why am I hammering on these three things? I take it all over. The first one is gastroparesis or slow stomach emptying. Number two is cookery and cooking. And the last one will be food types. So let's go with gastroparesis. What is it actually? At what age do you develop this pathology? Is it chronic or acute? Is it common with women or with men? At what age do you experience this disorder? So essentially, gastroparesis is kind of stomach emptying. That is, you consume food and the food at some point stagnates. That's it. And this is quite common with diabetic patients. I try to limit my discussion only on diabetes because you can still experience gastroparesis even not being diabetic. So be careful here. Now, the trouble starts when your blood sugar starts spiking. When that blood sugar spikes, it affects what we call the vagus nerves. That vagus nerves runs down to your anus. So it regulates the movement of your stomach. It could be triangular, lateral, or all forms. That's when you eat any meal. For digestion to take place, there must be some movement, what we call peristalsis, like snake or worms moving, kind of a wavery sensation. So you hear about the parasympathetic nervous system and the sympathetic nervous system, the SN. So this is very important. Have you ever asked yourself, why is it that I took a meal, went to bed, and the next morning everything is gone? Yeah, because that parasympathetic nervous system are in action while you are sleeping. Just like you took a meal and your blood pressure kind of dropping, what we call postprandial hypertension. That one also has something to do with this condition. So as we are aging, we definitely suffer from this effect, and that takes you to what we call constipation. Worst case scenario, it can transform into stool impaction, which is not good. And that's why most of the time, elderly people call the ambulance while they are in the toilet because the vagus nerves has an issue, and that's why the stool doesn't come out. So you can imagine not having diabetes and you find yourself in that situation. Then if you're diabetic, it becomes even worse. So that's what I'm going to discuss today. So the key thing here it is put your blood sugar back in order. That is either eating the right meal, taking the right activity, and possibly taking your medication the right way. So those are the three things you have to do as a diabetic patient. I take it all over. Eating the right meal, the right time, and taking the right medication, and also activity. As a patient with diabetes, you need to stay away from that behavior of sitting like couch potato. Couch potato behavior will take you to nowhere. Sedentary life doesn't help you as a patient with diabetes. Being active, yes, it helps. And the activity here, I'm not saying that you engage yourself in a marathon. No. Because getting yourself in a marathon, you end up running out of energy because being a diabetic patient, you don't have enough. That's the food, the quantity of food that you have cannot keep you for that length of time. That's why diabetic patients cannot exercise for more than 30 minutes. 30 minutes are the max that you can do an exercise as a patient with diabetes. So if you want to go for swimming, make sure 30 minutes you have to stop it. You want to go for bicycle riding, 30 minutes you have to stop. You could do number of activities called them bouts, as much, I would say 4 times a day, but the duration should be 30 minutes each. Like so, you should be fine, because I don't want you to find yourself in what we call hypoglycemia. Because if you get into hypoglycemic situation, you end up going into coma, which becomes really challenging. Even I know it can be fixed, don't get me wrong. That's in such a situation, we need to bring in some glucagon and then bring it back to life. So that's the whole thing. The two hormones are glucagon and insulin. So those are the two, it's kind of a scale balance. So when you go too low with the blood sugar value, you could be giving glucagon in case of coma. And if it goes too high, then insulin comes in to bring things back to normal. Or you are taking your medication like metformin or the glycerides or whichever thing that your doctor prescribed for you. Your doctor is your companion. Remember, you will never walk alone if you have a doctor. Diabetes is not the end of the world. So take it easy, take instructions, do what you're supposed to do. And that's my message for you. And then in the next video now, I will tell you now what to do in this condition once you are diagnosed with gastroparesis. Take home message. What is gastroparesis? Simple. Slow stomach emptying. So most diabetic patients, they end up having trouble. When they take a meal, the meal remains stagnated in their tummy. It's not a good news. And that's why the size of your stomach keep increasing. It ends up going above 1, which is not a good news. It's supposed to be less than 1. So if your stomach is above 1, watch out. Check up. Make sure you are not suffering from that condition. You are not gastroparetic. That's my message for you. Once more, thank you, and like my page, go to my channel, make your comment, ask all your questions, and I will answer you. Once more, thank you. I am Dr. WAN. Have a wonderful evening. Ciao.